Hello, my name is Carlos Hernan Rodriguez Pineda. I am a veterinarian specializing in small animals, a master's candidate in small animal medicine with an emphasis on surgery and minimally invasive procedures. This time I am going to talk about endoscopy in veterinary medicine. Really, endoscopy is a practice that has been done for a long time in human medicine. Now we are doing it in veterinary medicine. For some years, we are initiating practices that are less traumatic for pets and help us with better diagnoses and procedures. I am going to present the endoscopy equipment, with which we perform it. This is the image processor, this is the monitor, which has to be a medical-grade monitor, to give us the intensity, the quality of the image we need to do a procedure and give proper diagnoses. This is itself, the endoscope. At this time I am showing you, it is a gastroscope endoscope, for its diameter, 8 mm, is to perform procedures at the gastrointestinal tract level. In the gastrointestinal tract, I am talking about from the esophagus, the stomach, passing through the cardia, the pylorus, and at the level of the anal ubeta, along the length of the endoscope, we reach those areas. We use thinner equipment which are the bronchoscopes that the diameter is smaller from 5 mm and they are useful for airways, which we are using for diagnoses of both airway diseases and digestive tract diseases. The use of this equipment is indicated in patients where a good clinical history, anamnesis, previous paraclinical examinations have been done, such as blood counts, renal function tests, liver function tests. Because in the case of the gastroscope, we are going to use it in patients who come with clinical histories of constant vomiting, chronic diarrhea, where inflammatory diseases are suspected, where foreign bodies are suspected, where there is a suspicion of tumors, polyps, trichobezoars. In cases in which other paraclinical methods have already been used, which have not been conclusive and have not led us to a diagnosis, in these patients, the recommendation is to make a diagnosis by endoscopy. As I said, the diagnosis by endoscopy can be airway, bronchoscopy, digestive tract, esophagoscopy, gastroscopy, gastroendoscopy, or rectal colonoscopy. Likewise, the great advantage of these exams is that they are used as a diagnostic method. It is a diagnostic method that is very direct. It will take us to the point, it will take us directly to the mucosa, to observe the gastric mucosa, the mucosa at the level of the airways or the chronic mucosa, to see how is its conformation, its presentation, its coloration, and in addition to the direct visualization, it allows us to take samples through biopsies, its presentation, its coloration, and in addition to the direct visualization, it allows us to take samples through biopsies. For these cases we use special forceps, which are biopsy forceps, that go through this endoscope. They are passed through its interior, they are going to come out here to take the sample. I am going to give you a little explanation. We pass through here. The biopsy forceps with which we take the samples for the diagnosis. We pass it through the working channel, closed. We must see it come out through the site, through the end of the endoscope. This is what we observe, through the monitors, and with this we take the biopsies. I was telling you, the gastroscope and all this endoscopy equipment is useful for diagnosis. direct visualization of the structures, as well as for taking samples and diagnosis. Another of the great advantages of this equipment is that we not only stay in the diagnosis, it also serves as a therapeutic plan in which cases, we can resect tumors at the gastric level, we can resect structures, such as gastrointestinal polyps, which are round masses that come out of the mucosa. With other forceps we round it and we do the resection of the structure that is generating the pathology, the pet's disease. It is a more constant practice. Let's say gastroscopy is used more in cases of foreign bodies. We know that pets are very given to eat anything that catches their attention. We remove balls, parts of dolls, mango seeds. In the case of cats, a lot of trichobezoars or hairballs. By constant licking they are consuming hair. They form foreign bodies that will induce vomiting and obstructions. In these cases it is very practical to perform gastroscopy. It is a practice in which we have been inviting colleagues, to use more gastroscopy, endoscopic diagnosis and treatment, because, in this way we avoid invasive procedures. To remove a foreign body we will not have to make incisions at the abdominal level, enter the stomach, and to remove a foreign body, simply under general anesthesia. We enter with the endoscope and with a special forceps for foreign bodies, we remove it that way. It is a very fast procedure, it is a very safe procedure, it is a procedure in which the patient, once they come out of the anesthesia, recovers and goes home. Otherwise, if we do not use a gastroscope to remove foreign bodies, we will have patients who must undergo surgery by laparotomy. They will have to spend several days in the hospital. In the recovery process, they will have incisions. It will generate more pain, which we must avoid. Using this equipment, these methods, both diagnostic and therapeutic, in other cases also, for example, patients arrive with chronic vomiting, who do not know why they are vomiting. All the treatments have been done, all the traditional medications have been used, but the patient continues vomiting. In these cases gastroscopy is very indicated, because there are diseases such as chronic inflammatory bowel disease, which is diagnosed only by direct biopsy of the mucosa. There are also alterations that patients who have constant reflux are treated. For reflux, vomiting, all medical management is done, all paraclinical tests are done, but the patient remains the same, so gastroscopy is recommended as a diagnostic method. As a therapeutic method, there are pathologies such as cardiac insufficiency, which will not be diagnosed in any other way. It is very complicated even with radiology to diagnose. These are patients that will be presenting constant vomiting, progressive weight loss, alterations directly related to the return of the gastric content through the esophagus. They generate esophagitis. These are patients that with all the tests, with all the treatments are not going to be responsive. The only way of diagnosis is by means of gastroscopy. The same with the rectal route, patients who have chronic diarrhea with mucus, with blood. We do all the coprological tests, we do treatments, but the stool remains the same, the diarrhea continues. To that extent, it is not recommended to use the same equipment, but for colonoscopy, it requires the same as gastroscopy, a preparation, a fasting period of 12 hours for solids, 4 hours for liquids. In the brachycephalic, the flat dogs, they need a preparation of a fasting period of 18 hours, a longer fasting period with them because it is more delicate for the return of the reflux. With the preparation we are going to pass the probe to the patients. We take the samples. In the case we were talking about the colonoscopy, the sample is taken directly. It is very important to do enemas. washings, to have a good visualization and a good diagnosis. Returning to the use of the endoscope for airways, we have also removed foreign bodies from airways, needles, that have gone through the airway. They have gone through the trachea and are located in the bronchi. Extraction via surgery, by thoracotomy, is really very traumatic with a very poor prognosis. We use bronchoscopy. Bronchoscopy is that we use a probe that is smaller in diameter than this one. We enter through the bronchial tree. We go to where the foreign body is and through a forceps. That can be like this one, biopsy forceps or forceps for foreign body. We take it and we remove it. These are cases that have been used in the practice of small medicine. Other clinical cases that are presented and the use of bronchoscopy is recommended, is the case of washings and for diagnosis, bronchial trachea washings. We enter with the probe, we take the sample, we wash it, we inoculate liquids through the probe, we collect them and they are sent to culture tests and antibiograms. In that way, helps us for diagnosis and treatment, for example bronchoscopy of foreign bodies and direct sampling there, ultimately a gastroscopy, bronchoscopy, colonoscopy, is a therapeutic method, very appropriate, very advantageous that helps us so much and avoids practices that are more painful and with more reserved prognosis for pets. Thank you very much. That's all for today. Carlos Hernán Rodriguez Pineda, veterinary doctor, specialist in small animal medicine of the Veterinary Clinic Santa Teresita, spoke to you.